Hello, this is a video lecture for abbreviations and symbols. So it's pretty important for VOAs to be able to understand a lot of the abbreviations and symbols that might be used in patient files. We want to use consistent and approved abbreviations when writing in files because we want our files to be able to be understood by whoever we send them to. So if I write something in my file and I use an abbreviation and I need to send that file to you for a second opinion, I need to have used abbreviations that you can understand. So there are a lot of just industry accepted abbreviations, and that's what this lecture is going to cover. So first we're going to start off with some industry abbreviations. So our first abbreviation is AAHA. This stands for the American Animal Hospital Association. So the AAHA is responsible for making like guidelines for animal hospitals to follow for like best care. They have a lot of position statements and education things for owners and clients. So they're definitely something that you will see mentioned quite a bit. So the AAHA is the American Animal Hospital Association. Next we have the term AAHT, or sometimes RAHT. So that stands for Registered Animal Health Technologist. So that's what my title was when I first started working, I was an AHT. I graduated from the AHT program. I was registered, so I was an RAHT. But a few years ago, the Technology Association in Manitoba decided to revamp and modify our name. So now a little lower down here, you'll see RVT. So Registered Veterinary Technician or Technologist is what I prefer. And so now that's our new position title, is Registered Veterinary Technologist. So initially that animal health technologist, the association just felt like that didn't really make it clear what our job was or what our role was. Just on a side note here, the difference between technician and technologist in Canada, technically the terms are used interchangeably. I prefer to be addressed as a technologist personally, because technicians are people that have studied how to do a task, and a technologist is a person who has studied how to do the task and also understands the reasoning behind the task. So a technologist just has more of an education and more of an understanding of their tasks than a technician does. So I prefer to be addressed as a technologist. So moving down our list then, we have the AKC and the CKC. So that's the American or the Canadian Kennel Club. So these guys are responsible for keeping like records of dog breedings. They're the people that, maintain breed standards and things like that. So if you hear someone saying that they have a registered animal or that their animal has their papers, they're probably registered with the AKC or the CKC. So next we have the Cvma, that stands for the Canadian Veterinary Medical Association. The AVMA is the American Veterinary Medical Association. And a little bit lower down, MVMA is the Manitoba Veterinary Medical Association. So the Cvma is obviously Canadian, so they kind of speak for veterinary medicine in our country as a whole. But veterinary medicine is the bylaws protecting it are exclusive to provinces. So the MVMA is our association in Manitoba. So any veterinarian or technologist that's practicing in our province has to be registered with the MVMA. So they're responsible for making the rules about practicing vet medicine, and they're responsible for following up on those rules. So they would take and hear cases of malpractice or things like that. So basically they're kind of like a legal side. They also do a lot of advocating. Anytime anything in the news happens involving an animal, the MVMA will be probably making a statement on it. So DVM stands for Doctor of Veterinary Medicine. So that's basically your veterinarian. This is a little bit of, I think, a silly abbreviation, but K9 stands for canine, which is dog. And then just skipping down to the bottom here, we have SA, which stands for small animal practice. You might see LA for large animal practice, and MA, which is like mixed animal practice, so small and large. And then lastly, we have the SPCA, which is the Society for the Prevention of Cruelty to Animals. So the SPCA is kind of like in Winnipeg here, the equivalent would be our Humane Society. So lots of provinces, lots of states in the US have SPCAs. Here in Winnipeg, we have the Winnipeg Humane Society. Okay, so moving on, we have our clinical abbreviations. So these ones are pretty easy to know because basically it's the first letter of the term followed by an X. So biopsy is BX, diagnosis DX, differential diagnosis DDX, fracture FX, history HX. This is the only one that might trip you up. Prescription isn't PX because that's already used by Prognosis. So prescription is RX. So think of Rexall, right? Rexall is a pharmacy. They fill prescriptions, and RX is kind of right in there in their name. So prognosis PX, surgery SX, and treatment TX. Basically, these abbreviations exist so that doctors can write them in the file and not have to write out the entire word every single time. So something you'll learn quick about doctors, I think they like to call themselves efficient. I sometimes question if they're just a little bit lazy. So they do a lot of abbreviations in their files. So I figured I would just let you know what these terms mean. I think it's a little bit easier to memorize something if you have an understanding of what you're memorizing. So instead of just knowing biopsy equals BX, but you have no idea what a biopsy is, I feel like it gives you a little bit better of a picture. So a biopsy is just like a small piece of something that you're sending away for testing. So if you suspect a lump might be cancerous, you can take a small piece of that lump and send it away to be tested. So that's a biopsy. We can also do a diagnosis. So the DX is diagnosis. And our next abbreviation here is differential diagnosis. So the differential diagnosis, the DDX, that's like the question of what might be going on with an animal. So let's say an animal comes in, a cat comes in because it's vomiting. So animals can vomit for a lot of reasons, right? So the differential diagnosis might be maybe it's a foreign body, so they ate something that they shouldn't have, like a string. Maybe it is a toxicity, so maybe they ate something that's poisonous, so let's say chocolate. Or maybe they have kidney disease, okay? So kidney disease can cause vomiting. So the doctor then is going to request some testing, so maybe some blood tests and some x-rays to see what's going on. Once we get the results of those, they'll be able to make the actual diagnosis. So the differential diagnosis is the doctor's guess at what it might be. After doing testing, we can narrow it down. So let's say we get the blood results back from that scenario and okay, it looks like the cat has kidney disease. X-rays are all clear. There's nothing weird in there. Our diagnosis is kidney disease. Okay, so that's like the illness that the animal has. The differential diagnosis is the guess at what it might be before we can narrow it down. So FX is fracture. It's just, you know, like a broken bone. HX is history. So the history is like the background information about the animal and its illness. So the history is usually things that the owner can tell us. So they've been vomiting for 3 days. It came out of nowhere. They've been fine up until then. We did do some traveling. Like those kind of things are history. I changed the food recently. Those are all history things. In office procedures, we talk more about how to take a history. So prescription RX, you guys are probably familiar with prescriptions already. I'm assuming at some point in your life you've had to have a prescription filled. So those are just like a drug prescription for a prescription drug from the doctor. So the PX is the prognosis. So the prognosis is basically the prediction just based on statistics of how the animal will do with an illness. So like a prognosis can be really good, excellent, good, it can be fair, it can be guarded, it can be poor, it can be grave, which means they'll most certainly die. So like rabies is a grave prognosis. If an animal contracts rabies and starts showing clinical signs, they will die from rabies. If an animal breaks its toenail, we can trim that toenail, maybe give you a prescription for antibiotics if it's infected, and it will heal. So that's an excellent prognosis, okay? SX is surgery, so I don't know if you really need more explanation on that. You know, cutting the animal open somehow. And TX is treatment. So treatment can include anything like, you know, a procedure, so like a nail trim, or it could be like a drug or a surgery, etc. Okay, so our next category is standard abbreviations. So these are things, if you took science class in high school at all, you probably have some familiarity with. So the first few are substances. So CO2, that means carbon dioxide, so that's the gas that we breathe out. H2O, that is water. H2O2 is hydrogen peroxide. K is potassium. Na is sodium. NaCl is sodium chloride or salt. O2 is oxygen, so that's what we want to breathe in is oxygen. P is phosphorus. So all of these are just their chemical symbols. So if you ever took chemistry, you might recognize a lot of these already. And these are all different, I guess, substances that we'll use in clinic. Okay, so next we have some temperature. So we have degrees Fahrenheit and we have degrees Celsius. In Canada, we tend to take temperatures in Celsius and report them as such. In the States, in US, they tend to use Fahrenheit. Yeah, so every time you read a report and it's out of an American source, the temperatures in the case study will be in Fahrenheit, which is annoying. I always have to convert, because I don't understand Fahrenheit at all. Okay, so then some others, we've got ppm, which stands for parts per million. So that's like a measure of concentration. RPM is revolutions per minute. And we'll talk about that when we're talking about centrifuges. So we use a centrifuge to spin samples, and they need to spin it a certain number of revolutions per minute. So SOLN or SOL''N is for solution. MSDS is material safety data sheets. Once you've completed your WMIS training, though, I think you'll see that they don't talk about MSDS anymore. I think they just talk about SDSs. N/A is not applicable. WMIS stands for Workplace Hazardous Materials Information System, and you will learn more about that in your WMIS training course. Okay, so next we have our nursing and pharmacy abbreviations. So these are things that we'll see when we talk about giving animals medication in clinic, or when we are talking about prescribing medications. So again, we will get way more into these terms in our dispensing and nursing courses, but we will talk about them here as well to kind of get you started on them. So our first term is ad lib. If I were you, when you're making flashcards for these, I would switch these two. So the explanation is ad libitum. That's the Latin term for ad lib. That's what ad lib is short for. I don't care if you know that ad lib is short for ad libitum. I want to know that you know that it means as much as desired. Okay, so it basically means like at liberty. So take as much as you'd like kind of thing. So as much as desired would be the term. So with these abbreviations, we want to be really careful that we're looking at the cases of the letters as well. So capital letter AB stands for antibody. Lowercase a, lowercase b stands for antibiotic. So those are two very different things, right? And the only difference is that capital letter. So be careful when you're looking at capitalizing as well with these abbreviations, okay? So an antibiotic is a drug that kills bacteria. An antibody is a protective mechanism from our immune system that attacks a specific illness, okay? So right now there's that big race to see who can detect, who can create the vaccine for the coronavirus, right? This COVID-19. So what the intent of that vaccine is to give everybody antibodies so that they're immune to the illness. So that's an antibody, antibiotic. So next we have this AU or ADASAU. So this A stands for ear, and the D stands for right. S stands for left. U stands for both. A little bit later on, we're going to talk about the ears or the eyes as well. So for this, I like to imagine a cat And its ears are A's and its eyes are O's. So that's how I remember if it's O is eye and A is ear. I don't really have a good mnemonic for remembering that D is the right ear, S is left ear, and U is both ears. So like D, S, and U, I don't know, if you can come up with something, please share it with me, because I'd love to share something good for future classes. So AG, capital A, lowercase g, stands for antigen. Antigen is tied in with antibody. So the antigen is the thing that the antibody attacks. So antigens are just proteins on top of a virus or a bacteria. So capital AB, capital AG. So if that helps you to remember those two because they're linked with the capitals. So A/G stands for anal gland. So if we're doing an anal gland expression in clinic, often we'll just put AG on the file or on the schedule. When I'm writing about it in the file, I'll go A/G and then write my notes. So ARF, ARF, so cute, right? Stands for acute renal failure. Not that cute. So acute renal failure means basically a sudden onset of kidney failure. So ASAP, you probably know that one already, as soon as possible. BAR. So BAR is like a assessment of, I guess, mentition of the pet. So B stands for bright, A stands for alert, R stands for responsive. So a bright, alert, responsive, that cat is like right at the front of the bars when you walk into the clinic, meowing at the bars, really wants your attention. That's a bright, alert, and responsive animal, okay? BID, again, these are ones that I would switch the twice daily and the bis and die. Bis and die, again, is Latin. I don't care if you know it means bis and die. I want to know that you know BID means twice daily. So if we have to take a drug 2 times per day, that means we're taking it every 12 hours. So that's something we would see like on a prescription label as BID. BG stands for blood glucose, so that's a blood sugar reading. BM stands for bowel movement, so a poop. BM or BP is blood pressure. I'm sure you've all had your blood pressure taken at the doctor's. BPM stands for beats per minute or breaths per minute. For breaths per minute, I also go breaths per min. This is what I was taught in school, so you will see this too in practice. I think probably a lot of techs use that one because that's what we're taught in school. So breaths per minute or BPM. BW stands for body weight, so that's just the weight of the pet. A capital C, especially on a drug label, means that a drug is a controlled drug. Controlled drugs are ones that are potential to have human abuse or human addiction. So things like Valium, ketamine, those kind of things are controlled drugs. Fentanyl is one you'll see in vet clinics, and it's in the news a lot lately. So those are all controlled drugs. A CBC is a complete blood cell count. So a CBC is a type of blood test that looks just at the cells in the blood. So the red blood cells, the white blood cells, and the platelets. So that's a CBC. CPR stands for cardiopulmonary resuscitation. So if you use your word parts, you can figure out what this is. Cardio, right, means heart. And then pulmonary, that's referring to the lungs. So we're doing cardio, heart, pulmonary, lungs, resuscitation. So CPR, we're doing if an animal's heart and breathing has stopped. We're going to try to do CPR. So that's chest compressions and artificial respirations to try to get the animal resuscitated or back to life. And we do teach CPR in nursing. So you will learn how to do chest compressions in animals in that class. So CRT stands for capillary refill time. So capillary refill time is a measure of how quickly an animal's capillaries fill back with blood after you empty them. So we can do the CRT by pressing on the gums of the animal. So I usually like to do it right over the canine tooth. You press on that. In a normal animal, it's going to turn white when you press on it gently. And then when you release the pressure, it will turn back to pink really, really quickly. So anything longer than 2 seconds to turn back to pink, we start being concerned about that animal's blood perfusion. So perfusion is just how blood is getting through the body into the tissues. Our next is C/S, which stands for clinical signs. So clinical signs are the things that we can readily observe about an animal that makes us think that the animal might be sick. So like vomiting is a clinical sign, diarrhea is a clinical sign, profuse drooling is a clinical sign. In vet medicine, we talk about clinical signs rather than symptoms, usually. Sometimes people still use symptoms. But a symptom technically is something that you can describe that you're feeling. So I can describe that I have a headache and that I feel nauseous. An animal cannot tell me that it has a headache or that it feels nauseous. But I can look at an animal and make the conclusion that they might have those feelings based on their clinical signs. So if an animal is squinting their eyes and seems to be really reactive to large noises, I could guess that they might have a headache. If they are profusely drooling and making that sound that cats make right before they throw up, I can assume that that cat might feel nauseous, right? So we talk about clinical signs as something that we can observe. A C-section, that stands for cesarean section. So that's a surgery to help an animal birth their babies if they aren't able to birth them vaginally. A C and S is a culture and sensitivity. So this is a test we can do. We can send it away to a lab with a sample and they can do a culture. So they're going to try to grow bacteria from that sample. And if they are able to grow bacteria from it, they're going to tell us what bacteria it is. And they're also going to tell us what the bacteria is sensitive to. So they'll tell us which antibiotic will kill that bacteria best. So that's a CNS, or a culture and sensitivity. And you can do a culture and sensitivity on any sample from the body. So you can send urine, you can send blood, you can send swabs from the skin or the ears or anything. So CNS stands for central nervous system. We'll be learning more about the CNS in our anatomy section. Our next two are cat breeds. So DSH is a domestic short hair, DLH is a domestic long hair. So I find that most people do not know the breed of their cat. Unless they have like a specific breed that they know of, so like the cat's a Siamese or like a Himalayan or something, most of the time it's just a domestic short hair or a domestic long hair. So when I'm taking signalment from people, so the signalment is like the information about the pet, I'll ask, and do you know what breed your cat is? And if they're like, cats have breeds, I'll say, does your cat have long hair or short hair? And then I'll record it as DLH or DSH. Some people use DMH as well, domestic medium hair. I use that as well. I'm fine with that as an abbreviation too, but I know some people get upset about that one. Okay, so D/R is a drain removal. So we'll place a drain sometimes in wounds when we close them up so that it can drain out any of the fluids that are occurring underneath that wound. We do need to take that drain out though, because if we leave it in for longer than like 5 days, we're going to start seeing it increase the amount of fluids in that area as opposed to draining them out. So usually the drain removal is going to happen 3 to 5 days after surgery. GT, the meaning for GT is drop. Again, this is a Latin explanation. Gutta is the Latin for drops. GTT stands for drops, so plural, and then guttae is the plural Latin for that. So DOA is something hopefully you don't have to deal with too often. It stands for dead on arrival, and I feel like that one's fairly straightforward and self-explanatory. DPM stands for drops per minute. When we're talking about drops per minute, we're talking about a fluid rate. So when we have an animal on IV fluids, we can control how much fluids they're getting using drops per minute. An E-tube or an ET tube stands for endotracheal tube. So again, let's use our word parts to figure out where this is going. So endo, what does endo mean? It means like inside or within. And trachea is referring to the trachea or the windpipe. So an endotracheal tube is going inside the trachea. We use that during anesthetics to make sure that we can deliver anesthetic gas directly to the lungs and to protect that airway. FB stands for foreign body. Typically, most often, you're going to see foreign bodies in the stomach. So dogs or cats eating things that aren't food and then getting them in trouble. Ferrets too. Ferrets are really notorious for foreign bodies. So, like my cat had a foreign body one time for Christmas. I gave him a little toy. He was playing with it. And then as I watched him play with it from across the room, I saw him swallow it. And I went running over to him, but it was already gone. So I had to make him throw up on Christmas. What a wonderful gift to him. So anyways, a foreign body is an animal eating something that they should not have eaten. You can have foreign bodies elsewhere though. So I have seen foreign bodies. I've seen a fish hook lodged in an animal's skin. My very first cat that I ever had a foreign body of a BB bullet was lodged in her skin. She was a stray I had adopted, and I noticed she had this lump. I had a doctor check it, and it was a little BB, so they removed it when she was getting spayed. So you can have foreign bodies elsewhere in the body. One thing that you'll find foreign bodies, I feel like this is fairly common in the summers here in Manitoba. If you're familiar with those foxtails, it's like a weed. Those will often lodge in the pads, or not the pads, but like the webbing between an animal's foot, so like dogs usually, and sometimes the skin will start to grow over that, and then that's a foreign body, and we'll have to explore in there to get that out. Okay, so moving on, FBS stands for fasting blood sugar. So we're taking a blood sugar reading when the animal hasn't had a meal, usually in 12 hours. F/S stands for female spayed. So that just means an animal or a female animal that has had her uterus and her ovaries removed. So gauge can be abbreviated with a capital G or a lowercase g. Gauge is a number that tells you basically how big a needle is. GA stands for gas anesthetic or general anesthetic. So that's when we have the animal completely knocked out, not just sedated, but they're completely unconscious. So like for during a surgery. HBC is hit by a car. Again, I think that one's fairly self-explanatory. HR stands for heart rate. So we take the heart rate in BPM, beats per minute. So the next few are all types of injections. I'm just going to skip IC for a second. ICU is the intensive care unit. You guys have probably heard a lot about ICUs in the news lately, again, with all this coronavirus stuff. Okay, so this is a type of injection. So intracardiac. So we can use our handy dandy word parts. Intra means within. Cardiac is referring to the heart. So this is an injection that's going directly into the heart. We're not going to do that too often. We are only really going to do an injection into the heart in an emergency where like the heart is stopped. You can give epinephrine directly into the heart and hopefully it'll get beating again. Or if we're doing a euthanasia, sometimes we'll do it into the heart. So ID is intradermal. So again, intra, within. Derm is referring to the skin. So this is an injection going into the dermis of the skin. When you guys get your rabies injections, those ones are intradermal. INFX is an abbreviation for infection. IM is intramuscular. So intra, within, muscular, it's referring to a muscle. So it's an injection into the muscles. IN is intranasal, so that is not necessarily an injection. We're usually just spraying something into the nose. So INJX is just injection. I also just do INJ as well. IP is intraperitoneal. I can't remember if peritoneum is in our word parts. So the peritoneal space is like the abdominal space. So an intraperitoneal is an injection going into the belly, but it's not going into any of the organs in the belly. So just into the space between the organs in the abdomen. So IU is a tricky one. It's trying to trick you into thinking it's an injection, but it's not. IU stands for International Unit, and this is a measure that used for insulin. So it's an insulin measurement. Next we have IV. So IV means intravenous. So vein is referring to veins, right? So intravenous is going into a vein. You can have an intravenous injection or an intravenous catheter. So make sure when you're talking about these that you're using intra, because that means within. Inter means between. So you don't want to say that you're putting something intermuscular because it means you're putting it between muscles, or intravenous, it means you're putting it between veins, and that doesn't make sense. So it's intra. Make sure you have that straight. So L is for left, easy peasy. LRS stands for lactated Ringer's solution. Lactated Ringer's is a type of IV fluids. MM, so you can do capitals or lowercase. It stands for mucous membranes. So we're talking usually about the gums there. So just like we had FS for female spayed, we'll use MN for male neutered. Sometimes you'll see MC for castrated. Castrated and neutered both mean the same thing. The animal no longer has its testicles. N stands for normal. I'll also write normal as a lowercase n with a line over top. NSF means no significant findings. So we use NSF sometimes instead of saying that a sample is negative. So if I'm doing like a fecal float, let's say, and I'm looking for parasite eggs, if I can't find any in that sample, I'm going to say no significant findings. I'm not going to say negative, because it is technically possible for an animal to have an intestinal parasite and not have eggs in the stool. Either the parasite isn't producing eggs yet or at that moment, or I just happened to get the lucky piece of stool that had no eggs in it. Either way, I can't surely say that an animal is negative for intestinal parasites, but I can say there was no significant findings. NPO, again, this is one where I would switch the explanation. NPO means non per os. Again, what does that mean? I want you to know that NPO means nothing by mouth. Okay, so nothing by mouth means no water, no food, no medications, nothing by mouth. NT just stands for nail trim. O, so this is an O with a line over it, just the way I have the N with the line over it. That just means owner, so referring to the owner of the animal. Oh, and then here's our eyes, right? So if you think of the cat, A is the ears, O is the eyes. So OD is right eye, OS is left eye, OU is both eyes. So OVH or OVE stands for ovariohysterectomy. This is a Spay surgery. So again, let's use our word parts here for practice, okay? So we have ectomy, right? We like to look at this suffix first. Ectomy means the surgical removal of. Ovary is ovary, that one's easy. The O is just the connecting, or the what is that, conjoining vowel, something like that. I can't remember the term right now. And hyster is for the uterus. So an ovariohysterectomy is a removal of the ovaries and uterus, and that's a Spay surgery. The OR is the operating room. OTC is over the counter. So OTC or over the counter drugs are ones that you can buy without a prescription. So like in humans, we'll buy like cough syrup or Advil over the counter. If you have a prescription medication, you can't buy that over the counter. P stands for pulse. We'll do often together TPRs. A TPR is just a quick vital sign check. P is pulse. T is temperature. R is respiration. The PCV is the packed cell volume. So a packed cell volume is, we take a little tiny tube and we fill it up with blood, and then we spin it in a centrifuge. When it's all spun down, it's going to separate. Down here, it's all going to be red with blood, and then up here will be just the fluid that the blood is in. So we'll be able to take this and line it up on these little cards, and they have these little dashes, and it gives you numbers. So a normal animal is usually like, let's say like 48% is the packed cells. So that means how much red blood cells make up the blood, 48%. I have seen as low as, so if I draw the thing again, I've seen like way down here, and it's like 17%. The lowest I've ever seen is 9, and that animal we did blood transfusion immediately because that is a very sick animal to have that little amount of blood. So the packed cell volume is just like a test for anemia. So PD stands for polydipsia. Dipsia is thirst. Poly is many or much, right? So, or excessive. So PD is polydipsia. PD and PU go hand in hand. PU is polyuria, so lots of urine, right? If you're really thirsty, you're going to drink a lot of water. If you drink a lot of water, you're going to pee a lot. Or on the flip side, if you're peeing a lot, it's going to make you really thirsty, so you're going to be polydipsic as well. So polydipsia, polyuria. We also have PP, which is polyphagia. So phage, remember from our word parts, is eating. So PE is the physical exam. So that's the doctor doing the checkup on the animal. So, you know, looking in the eyes, the ears, the mouth, listening to the heart and the lungs, feeling the animal all over. That's the physical exam. A PM is a post-mortem. Sometimes we'll call this a necropsy. So that's doing an exam on the animal after it's died. So often it involves cutting open the animal and taking samples and looking at the organs to see what might have caused the death. So a PO means per os. So this means this is by mouth. So remember we had NPO, which was nothing by mouth. PO is by mouth. It could mean post-op. I don't really see that very often. PR stands for per rectum. So that is like a suppository, a drug going into the bum. PRN, again, this is one. I don't care if you know that PRN stands for pro-renata. I want you to know that it means as needed. So if we give a drug as needed, like we take Advil or Tylenol or whatever, PRN. We take it as needed if we have a headache or something. Q, a lowercase q like this, stands for every. So in medications, we might write like Q4H, and that means every 4 hours. Remember when we talked about BAR, bright, alert, and responsive? QAR stands for quiet, alert, and responsive. So if our bright cat is right at the front of the cage and meowing and trying to get our attention, the quiet, alert, responsive cat is sitting at the back of the kennel, and they're like, oh, hi. Yeah, nice to see you. And they're not really trying to engage. They're there, they're awake, but they're not trying to play or anything. So QD, we've got that lowercase q, so that means once or every, and D means day, so every day or once daily. QH, every hour. So it might be like Q7D would be every 7 days. Q8H is every 8 hours. Oh, Q4H every 4 hours. If we have QID, however, that means 4 times a day. So I'm just going to write, I don't know if you can see this, I'm going to move this up a bit. So we have SID, BID, TID, and now QID. So we talked about BID, that means 2 times per day. Now we're talking about QID, which is 4 times per day. These are like the most common prescription directions you'll see is SID, BID, TID, and QID. We'll fill the other ones in as we get to them, but I bet you can already guess what numbers they will be. So QN would mean every night. I don't see that very often. QOD or EOD both mean every other day. So don't get QOD mixed up with QID, okay? That O means other, every other day. R stands for right, which is the opposite of L for left up here. RBC is red blood cells. It can mean a red blood cell count as well, but typically if you see RBC, it means red blood cells. And that's part of the blood. We'll learn more about that when we talk about the cardiovascular system. So RTG just means ready to go. So if we've finished everything for an animal, we'll mark that animal's file as RTG, that they're ready to go home. RX is prescription. We talked about that one already. RXN is an abbreviation for reaction. So if an animal has like an anaphylactic reaction or an allergic reaction to a drug or a vaccine, we're going to write about an RXN in the file. REP stands for repeats. So in prescriptions, it's like a refill. RR is the respiration rate. SQ, SC, or sub-Q all stand for subcutaneous. So this is another type of injection. We had all these IP, IV, IC up here. SQ is subcutaneous. So let's use our word parts. Where is this going? We have sub meaning below, and we have cutane meaning the skin, and then us is just referring to, right, or pertaining to. So this is an under the skin injection. And our last page here, we're almost done. So the SIG is short for Cigna. And it just means this is what you should write on the label. So when we're talking about prescriptions and you see SIG and then the instructions, SIG just means put this on the label for the client. Okay, an SOP is a standard operating procedure. So a standard operating procedure is step-by-step instructions on how to do a task. So you'll see a lot of, standard operating procedures in clinic. In the clinic, it's really important for everyone to do things the same way, so that we see if there's any mistakes really easily. So if I do something and you do it differently than me, you just might not have gotten to that task yet, like that step, if I do that step sooner than you, but I might think that you've made a mistake. So we have standard operating procedures to make sure that everything is done properly and in the right order.